Okay, hey everybody, it's Dr. Mexico back again. And today we're going to be continuing my series into why grains inflame. So this is going to be part 2 of why grains inflame. And today we're going to be talking very basically about gluten and gliadins. So if you want to pick a fight with somebody in healthcare right now, if you really want to start an argument with somebody, have a discussion about gluten or gliadins. And if you really want to really kind of tease out whether or not the healthcare provider that you're talking to has any idea about what's going on currently with new research into nutrition, should ask that healthcare provider what their opinion is on gluten. And if that healthcare provider tells you that gluten is perfectly fine, it's perfectly healthy for individuals who do not have celiac disease, you can make or draw up a pretty clear conclusion that healthcare provider is not keeping up on current research when it comes to the field of nutrition. And then if you want to just basically anger somebody, you mention the topic of gluten, because people are either, for whatever reason, they're either very anti-gluten consumption, or they are pro-gluten consumption, and nothing in the world can be wrong with gluten unless you have celiac disease. Well, I'm here to give you just very basic information about gluten, and from the perspective of this video today, realize we're really only talking about gluten and its role in promoting inflammation or causing inflammation. So there's several other deleterious health effects of gluten, but for today we're going to be talking primarily about just gluten and its role in inflammation. So what is gluten? What is gluten? So gluten is really the main protein that is found in many grains. Gluten can be found in wheat, rye, barley, and spelt. So gluten, or glutenins really, in gliadin are the main proteins that are responsible for giving the grain its kind of sticky, gooey, kind of doughy texture. And we classically are aware of the term gluten really only with respect whatsoever to people who have celiac disease, which generates and causes a lot of gastrointestinal distress almost immediately upon consuming it. And it's verifiable. It's a well-known autoimmune disease, and it can be tested for. So classically, we're thought if you don't exhibit these immediate symptoms after consuming a product that contains gluten, well, then you're fine. You can eat as much gluten as you want. And that could not be further from the truth. What we do know now is research has shown that all of us, whether we're gluten sensitive or not, is that gluten, everybody that consumes gluten, will experience a gastrointestinal inflammatory response through the production of something that's called interleukin-15. That's just one way that glutens cause inflammation. So all of us, when we consume gluten, when we eat gluten, our body increases the production of an inflammatory chemical called interleukin-15. Another way that gluten leads to the production of inflammation in all of us is the role that gluten has on the body's release of something that's called zonulin, or zonulin, as some people will say. So normally our gut cells are very closely, tightly packed together. They're held very tightly together. And when we consume, in fact, the word that is used to describe the feature that causes this is called tight junctions. So our intestinal cells have something that's referred to as tight junctions. Well, when we consume gluten, our body causes the release of something called zonulin. And zonulin causes disturbance in those intestinal cell tight junctions, the gut cell tight junctions, GI tight junctions, which allows certain proteins and bacteria to be absorbed unnaturally. And this causes an inflammatory cascade that essentially mimics an injurious response. So our body is trying to fight off these extra proteins or these bacterial cells. So those are the two primary ways that gluten increases inflammation. So it increases inflammation by causing the release of zonulin, which then activates the nuclear factor to produce even more inflammation. And it also has an actual localized increase in a substance called interleukin-15. So whether or not you have celiacs, gluten should be avoided, or gluten-containing food should be avoided. Now, this doesn't make me happy either, people. Understand that. Listen, I wish this weren't true. I mean, anybody that knows me, any of my patients that know me, that I educate on anti-inflammatory nutrition, they know that I am a huge addict to pizza. So whenever I cheat on my anti-inflammatory diet, I cheat with pizza. So I wish this wasn't true. But you can thank that there's a doctor, he's an MD, and he's a professor of neurology in the United Kingdom, and his name is Dr. Haji Vesayu. He is one of the leading researchers, probably the leading researcher on gluten. And what he tells us is many people who have gluten insensitivity or gluten sensitivities do not experience any GI distress whatsoever. You do not have to have GI distress in order to have a gluten problem. For many people, it can be exclusively neurological symptoms that they express. I mean, gluten sensitivity has been linked to several diseases. Some people have such a severe sensitivity to gluten that just being off it for a day, they start to feel drastically better. So really the general rule is if we can get people off of it for one day to 14 days, you can usually pretty readily indicate whether or not their symptoms are coming from a gluten sensitivity or not. So again, the take-home message of this video is just because you do not have celiac disease does not mean gluten is safe for you. And again, from the perspective of this several-part series that I'm putting together on why grains inflame, understand there's really two reasons why gluten inflames. And again, gluten causes a localized release of interleukin-15, which is an inflammatory chemical, and gluten causes the release of something that's called zonulin, which then in turn causes our body to mount an inflammatory response to some of the byproducts of the zonulin release. So I know it's not fun to hear, and I know you guys want to eat your pizza just as much as I do and other floury, doughy foods, but gluten is one more reason why grains inflame. So for this part 2 of why grains inflame, this is Dr. Mexico, and make it a great day.